Welcome to the American Academy of Research and Academics. Today, we're diving into a topic that can really boost your academic and clinical portfolio: how to write and submit a case report. If you've come across an interesting case during your rotations or practice, this episode is for you. So, why should you write a case report? Case reports have been a fundamental part of medical literature for centuries. They provide unique insights into rare diseases, unusual presentations, and novel treatment strategies. More importantly, they serve as a learning tool for medical professionals by showcasing real-world clinical scenarios that might not be covered in textbooks. Case reports are particularly valuable for students, residents, and early career clinicians because they offer a relatively accessible entry point into medical research. Unlike large-scale studies, case reports require fewer resources, making them an ideal way to start publishing. They also help sharpen your critical thinking and writing skills while contributing to the broader medical community. Think of case reports as storytelling in medicine. Each case tells a unique story: how a disease presented itself, how it was diagnosed, and how it was managed. By publishing a case report, you're not only sharing knowledge, but also helping other healthcare professionals recognize and manage similar cases in the future. Another major advantage is career advancement. If you're an IMG, international medical graduate, or a student applying for residency, having a published case report on your CV demonstrates academic curiosity, a commitment to evidence-based medicine, and strong analytical skills. Program directors appreciate applicants who contribute to research, even if it's in the form of a single case report. Step 1. Choosing the right case. First things first, choosing the right case to write about. This step is crucial because not all cases are suitable for publication. When selecting a case, ask yourself these key questions. Is the case rare or unique? Does it involve an uncommon disease or an unusual presentation of a common disease? Has this condition been documented before in the literature, or does it add a new perspective? Does the case have educational value? What can other physicians learn from it? Does it challenge existing knowledge or reinforce a known clinical principle? Does the case involve a novel or unexpected treatment approach? Did the patient respond to an unconventional therapy? Was there a deviation from standard treatment protocols that led to a successful or unexpected outcome? Can the case contribute to clinical decision-making? Will this case help other doctors make better diagnostic or treatment decisions? Does it present a new complication or interaction that hasn't been well documented? Once you've identified a promising case, do a quick literature search. Check databases like PubMed, Google Scholar, or specialty journals to see if similar cases have been reported before. If your case has already been documented, consider how yours differs. Maybe your patient had an unusual demographic, coexisting conditions, or a different treatment response. Lastly, discuss the case with your supervisor or attending physician. They can provide valuable insights into whether the case is worth writing up and may even co-author the report with you. Collaboration with experienced professionals increases the credibility of your work and improves the overall quality of the report. Step 2. Getting permission and ethical approval. Now that you've selected your case, the next step is ensuring that you have the proper ethical approvals and permissions in place. This is one of the most important aspects of writing a case report, as it involves patient confidentiality and medical ethics. Before you can proceed, you must obtain written informed consent from the patient. This is a non-negotiable requirement for case report publication. The consent form should explain the purpose of the case report, how the patient's medical information will be used, the fact that their identity will be protected, their right to withdraw consent at any time. Most journals require authors to submit a signed consent form along with their case report. If the patient is a minor or unable to give consent, you'll need permission from a legal guardian. Maintaining patient anonymity is crucial. Even if you have consent, you should never include identifying information in your case report. Here are some guidelines to follow. Avoid using names, initials, or specific dates that could reveal the patient's identity. Modify details slightly if needed, as long as they don't alter the medical significance of the case. Be mindful of images. If you're including clinical photos or scans, remove any patient identifiers, such as hospital numbers or dates. Most journals adhere to the HIPAA, Health Insurance Portability and Accountability Act, and ICMG, International Committee of Medical Journal Editors, guidelines, so make sure your case report complies with their confidentiality standards. Depending on your institution's policies, you may need Institutional Review Board, IRB, approval before writing and submitting a case report. Not all institutions require IRB approval for single case reports, but it's always best to check. Some hospitals and universities have specific guidelines regarding case reports, and failing to follow them could prevent your work from being published. If you're unsure, consult your institution's Research Ethics Committee or the journal's editorial policies. Case reports, while valuable, must be handled responsibly. You should avoid sensationalizing the case or exaggerating its significance. Stick to factual, evidence-based writing and maintain a neutral, professional tone. If your case involves an experimental treatment or off-label drug use, be transparent about it. Discuss the risks, benefits, and limitations objectively, and cite relevant literature to support your claims. By following these ethical guidelines, you ensure that your case report meets the highest standards of integrity, which increases its chances of acceptance by reputable journals. Now that we've covered case selection and ethical approvals, it's time to get into the writing process. A well-structured case report follows a specific format, which typically includes the following sections. Your title should be concise, but informative. It should highlight the key learning point from the case. Breakdown of important criteria. The title should accurately reflect the study's topic, including the key variables, population studied, and the primary intervention or outcome measured. Incorporate relevant medical terminology and keywords that accurately represent the research area to facilitate search. Aim for a brief and to-the-point title, avoiding unnecessary words or phrases. Highlight the novel aspect or key finding of the study. Follow a consistent format depending on the journal guidelines, potentially including the study design. The abstract provides a brief summary of the entire report. It should be structured with the following: background, case presentation, discussion, conclusion. The introduction sets the stage for your case report. It should explain why the case is important, provide background information on the condition, highlight what makes this case unique. This section describes the patient's medical history, symptoms, diagnosis, and treatment. Use a chronological order. Avoid speculation. Stick to the facts. Include relevant test results and imaging studies to support your case. This is the most critical section. Here, you should compare your case with similar cases in the literature. Explain why your case is unique. Discuss clinical implications, summarize key takeaways and implications for future practice. Cite all sources using a format required by the journal. One of the key aspects of writing a case report is adhering to the journal's word limit and formatting requirements. Every journal has specific guidelines regarding length, structure, and reference formatting, and following these rules can significantly increase your chances of acceptance. Most journals impose a strict word limit for case reports, typically ranging from 1,000 to 2,500 words. This limit includes the main body of the text, but may exclude references, tables, and figures, depending on the journal's policy. Some journals also require a structured abstract with a separate word count, usually 150 to 300 words. Here's a general breakdown of typical word limits. Abstract, 150 to 300 words. Introduction, 200 to 400 words. Case presentation, 500 to 1,000 words. Discussion, 600 to 1,200 words. Conclusion, 100 to 300 words. While it might be tempting to include extensive details, keeping your case report concise and focused is essential. Overly lengthy reports risk rejection for exceeding word limits or for lacking clarity. Selecting the right journal is crucial to getting your case report published. Consider scope and audience. Does the journal focus on your specialty? Impact factor. High-impact journals have more visibility. Open access versus subscription. Open access journals have wider readership but may charge fees. Case report-friendly journals. Some journals specialize in case reports, making acceptance easier. Use tools like Journal Finder by Elsevier, PubMed's journal database, Simaco journal rankings, Each journal has author guidelines that must be followed. Here's a step-by-step guide. Format your manuscript. Use the correct structure and reference style. Write a cover letter. Summarize why your case is important. Submit online. Most journals use submission portals like Shalaron or Editorial Manager. Respond to peer review. Be prepared to make revisions based on feedback. Wait for acceptance or resubmission. The process can take weeks to months. And there you have it. You can start your research journey by writing case reports. They are easy to write and quick to submit. From choosing the right case to submitting it for publication, writing a case report is an incredibly rewarding process. Whether you're a student, resident, or clinician, contributing to medical literature helps you grow professionally and academically. If you found this episode helpful, subscribe to our podcast for more research and academic tips. See you again next week. Until then, keep learning and keep writing.